Good afternoon and welcome to the Caregiver Teleconnection. My name is Glenda Rogers and I'm going to be your host for this afternoon session with Dr. Tam Cummings. We're going to be talking about the ABCs of dementias of the Alzheimer's type. And I know this is going to be a really interesting session, so I'm glad that you're with us. Today's sponsor is Vitas Healthcare, and Courtney Hernandez is with us this afternoon to tell us a little bit about Vitas. Courtney, go ahead.
Hello, everyone, and thank you for being here. So, maybe your husband or wife's symptoms started months or years ago, and they've struggled to find the words that used to come easily, or had trouble recognizing long-term friends or even names of cherished family members. Maybe they forget where they put something, or they hide items around the house for no reason. Maybe your wife forgot how to use the washing machine, or husband forgot how to use the electric drill. Maybe a partner can no longer remember how to cook their favorite meal. Sometimes the signs of Alzheimer's and dementia start long before reality sets in that this will be the new normal for months and years to come. While there will be many more challenges ahead, you can take comfort in knowing that there are other spouses, family members, friends, and members of your Vitas healthcare team that understand what you're going through, and then also what's ahead for you. At Vitas, we've specialized in this type of care for over 40 years, and we're eager to share our knowledge and self-help tips so that you can take better care of yourself while you take care of your loved one. Joining a support group is an important first step because it connects you with other people who have traveled this road before, or maybe even are on this journey right now. And they're available to listen, console you, and offer ideas, suggestions that can help. Another important first step is the simple conversation with your physician, specialist, and other family members who are involved in your loved one's care. Talking about your goals and values and preferences for care now will help you better understand the options that lie ahead. When symptoms worsen or decisions have to be made about the next level of care, you will be ready. These conversations are called advanced care planning, and they can be just as important as the medical treatments or therapies that your physician or case manager might suggest. And talking now about the care that you want and the care that you don't want helps to smooth the way to the types of care you or your loved one might need in the coming months or years. And you'll also be better prepared to make decisions about what's next, even if the decisions are very difficult and hard to make. So, if you do need help in caring for someone with Alzheimer's or dementia, an answer to a question, or services of a trusted hospice provider, you can always call Vitas Healthcare at 800-723-3233, or you can visit vitas.com. We specialized in hospice care since 1980 and now care for patients and their families in 14 states and the District of Columbia. So thank you very much for having me today, and y'all have a wonderful meeting.
Thank you, Courtney, and thank you to Vitas Healthcare. I'll post those numbers and the website in our chat box. And hopefully, if you were on your telephone, you wrote those down. If you do not find Vitas in your area, there are a multitude of hospice providers throughout the country, and you can probably just call 211 or directory assistance or look on Google, and you'll be able to find those. Once again, thanks, Vitas Healthcare. So now let me introduce Dr. Tam Cummings to you with just a brief summary of her background. Dr. Tam Cummings founded her company in 2009 with a mission to inspire, educate, and empower dementia caregivers. Now her professional gerontological practice in the Texas Hill Country is recognized as one of the leading educators of dementia caregivers and program design for dementia care nationally. Welcome, Tam.
Thank you, Glenda, and thank you, Vitas, and thank you, WellMed Charitable Foundation. And thank you to everyone who's watching. So today, Glenda, we're going to talk about Alzheimer's, and you are correct. The medical phraseology for Alzheimer's disease is actually dementias of the Alzheimer's type. And the word disease has now been replaced with the word dementia, and the word dementia has officially been replaced with the words major neurocognitive disease. So in your loved one's paperwork, you might see the letters all caps DAT, and that means dementia of the Alzheimer's type. You might see it written as Alzheimer's. You might see it written as dementia with or without behaviors. So in this session, what we're going to do is talk a little more in depth about how diagnoses are made and what are the different forms of Alzheimer's. So first of all, Glenda, as always, do you want the good news or the bad news?
The good news first. Come on.
Well, here's the good news. Dementias are not diseases of aging. Dementias are diseases of aging, but it is not normal aging. And when you are a professional caregiver, a medical caregiver, when you are a family caregiver of a person with dementia, you begin to think that this is what normal aging will be like. And it's really important that you understand it's not. Now, when you're in your 60s, the odds are 1 in 25 of developing a form of dementia. By the time you're in your 70s, the odds are now 1 in 17. By the time you're in your 80s, the odds are 1 in 6. By the time you live to be your 90s, the odds are 1 in 2. So one way of looking at that is for every person who's in their 90s and has dementia of the Alzheimer's type, there is another person living in the community who is aging normally, whose brain still functions in a regular fashion. So that's what those numbers mean. Now, that was the good news, unless, of course, you're actually in your 90s. The bad news is that the government is only counting Alzheimer's dementias in its numbers. So we know now that Alzheimer's disease is not the one and only dementia. There are over 128 identified dementias. Alzheimer's is thought now to be somewhere between 40 to 50% of those dementias. The numbers from Europe are closer to 40. And so if you redo the math, then it means that the real number of people in our country who have dementia of some kind is closer to 10 to 12 million Americans right now. And that projection for 15 years from now, when they estimate that 17 million Americans will have dementias of the Alzheimer's type, it really means that it's closer to 34 million people will have some form of dementia. And now there is another component that may be the effects of COVID may develop into something. Nobody's sure yet, but that is something we have to think about. And we're just not working with the right numbers. So the other thing is, a lot of people want to live to be 100, Glenda, but very few of them ever ask who will be around me when I'm 100. And you and I both know from our jobs that we see a lot of people who have reached the oldest old, people age 95 and above, and life is different for them because they've buried so many of the people that they know. So there is a good and a bad to everything. Now, this is Alice Alzheimer, and the lady is Augusta Dieter. And Augusta Dieter was 54 when her family brought her to the hospital in Germany where Dr. Alzheimer did her intake. And the family brought her because she didn't seem to always recognize who they were. She didn't seem to understand how to do bathing or cooking anymore. She was getting lost in the home she had spent her life in. She didn't seem to recognize objects or be as alert and aware as was normal. She got lost in the neighborhood she'd grown up in, and she had fits of rage and jealousy. And when Dr. Alzheimer did her intake, you can actually read his intake on the Lancet's website. His file on Augusta Dieter was found about 12 years ago. And he took notes on Augusta in 4 different languages, which is what I like to do, Glenda. I like to write in Latin for a little bit, and then I'll switch to a German dialect, and then I'll use a very rare language. That's how I like to write. But when his notes were translated, what's interesting is it looks just like something we would write today. Her long-term memory was still intact. She knew that the grass was green, the sky was blue, he was holding up 2 fingers, but other things were missing. She couldn't identify the food she was eating. She didn't recognize herself at times. She didn't recognize others, but at other times she would recognize people. And so he ordered her a daily spa bath routine. I know that's what my doctor wants me to do every day, is take a spa bath and have a massage. And he increased her diet and he increased her exercise. And in spite of everything they did, she continued to fail. This is the only known picture taken of Augusta Dieter. And when I teach this in class, I ask the staff to tell me how old they think Augusta Dieter is. And they think, because of her very disheveled look and because of the vacancy in her eyes and because of the loss of flesh around her face, they think that she looks like she's in her 80s. Sometimes people think she looks like she's in her 90s, and she's actually 56. This picture was taken 2 years before her death. So this is when Augusta Dieter died. Dr. Alzheimer was at another hospital and he was asked to come back and do her autopsy. And when he did the autopsy, he found 4 things. He wrote a paper about those 4 things. That paper was presented at a conference and then put into a medical textbook, and the chapter was called Alzheimer's Disease. He wrote that Augusta Dieter's brain, instead of weighing 3 pounds, weighed 1 pound, that it was full of cerebral spinal fluid, that it was had bone plaque growing in it, and that the brain cell structure that was left had neurofibrillary tangles in it, meaning that the neurons themselves had tangled. And those continue to be the 4 features of Alzheimer's disease today. Talk amongst yourselves for a minute. There's an evil squirrel taunting a dog, and I must take care of that. So just talk amongst yourselves.
Well, while she's doing that, I'm going to put up her contact information for town. So be patient while I go ahead and do this in the chat box. And for those of you on the phone, I will cover this a little bit later. Okay, she's back.
So when you look at your loved one and you're thinking that there's just words you've got to get out of your vocabulary, faking it, pretending, acting like, lying, showing off. They're not doing any of those things. It all has to do with how complex the human brain is to begin with. Our brain has over 100,000 miles of blood vessels. And Glenda, I can't even wrap my mind around that. It means you have enough blood vessels to circle the earth 4 times and have enough left over to get from Texas to New York and back. That is why you can have multiple TIAs, those tiny strokes, because they're happening in microscopic blood vessels. That's why they're not noticed. You and I have 100 billion neurons. Tending to those neurons are 400 billion glial cells. You don't have one file on the word banana. You have hundreds of files on the word banana. Banana that you cook with, a banana as a color, a banana as a piece of art, a banana bicycle seat. Monkeys like banana. The TV show called The Monkeys, where those 4 guys acted bananas. Banana is the food you ate. So it's not just that there's one area of the brain, it's all of these different structures in the brain carrying all of this different information, and the brain's still trying to function even as the disease progresses. And remember, in all of this, the person with the damaged brain, their brain doesn't realize it's doing anything wrong. And that's why they get so annoyed or angry when we point out what you're doing wrong. Now, the brain cells themselves become damaged. The dendrites are the roots of the brain. And as the dendrites grow, it's because the brain added more information to it. And as a new growth comes on that dendrite, it puts out new tabs or spines, and that causes the axons on the cell next to it to grow more little fingertips to connect to those new spines. And so the brain, as we age, becomes thicker and richer because we have more experiences that we've dealt with and learned. in normal brain function, tau protein should fold out in the dendrites and hold them nice and straight so that they can handle a chemical, a neurotransmitter, a chemical, and an electrical charge firing down them as the neuron reacts to send the message to the next neuron. And when that happens with millions and billions of cells, you get a thought or a movement. But in Alzheimer's, tau protein begins to fold incorrectly. Therefore, the dendrites begin to fold. Once they begin to do that, they no longer take in oxygen or food from the blood supply in the brain, and the cell slowly starves, dies, and is removed from the body in waste. And the cells die slowly. Some cells die in a few minutes, some in a few hours, some may take much, much longer to die. It's even been theorized that it may take some of these cells years to finally die. So it is the complexity of the brain that allows your loved one to do things. It's not that they're showing off or they're pretending. It's that they're using social skills when people are talking to them. And these are just some of the other cells that are in the brain, Glenda, and these are just simple drawings of them. But the brain actually pulsates, it does move, and it is just incredibly thick and complex. In this slide, you can see what a healthy brain, how it should fill the whole cranium, and how the person with dementia of the Alzheimer's type brain begins to shrink to the point that they can no longer, the brain is now floating in the cranium. And as each cell dies, it's removed from the body in waste. Now, when the doctor is talking to your loved one, when they're looking at testing of your loved one, it is to make a dementia diagnosis requires that 2 of 5 domains must be evidenced as being damaged in order for there to be a dementia diagnosis. So some persons could be so advanced that they actually have damage in all 5 domains. Some people it might be 4, 3, but you need 2 to be damaged in order for it to be a dementia diagnosis. Did that make sense, Glenda?
Yes, it does.
Okay, so first is an impaired ability to acquire and retain new information. And that's where the person is asking you over and over and over the same questions all day long. They're repeating the same conversation all day long. They've called you at work 20 times, and you're aware that they don't seem to be realizing that they know they've already called you, that they're not aware of that. And it is this constant repetition. Why haven't you fed me? And they've got an empty plate of food. And it can make you, the family caregiver, very, very agitated. And what you're witnessing is brain damage. When the brain does this, it means the disease is in the hippocampus and it has destroyed it. And the reason they're repeating things is they literally can't remember it because the piece of the brain that does that is either damaged, no longer functions, or no longer exists in the brain. So the first domain is an impaired ability to acquire new language. Next is impaired reasoning, the handling of complex tasks or poor judgment. This is somebody not understanding that you're telling them they can't drive anymore. They're not being obstinate with you. Their brain doesn't know that it's damaged, but you've ridden with them. You realize it's not safe. That tells you the frontal lobe is damaged. It also tells you the occipital lobe is damaged because part of their impaired driving was the inability to see things correctly. But when this frontal lobe gets damaged, it also means an inability to properly manage and understand finances. And Glenda, I think at least once every other time you and I talk, we talk about get the computer away from them, block them from being able to access finances, or you'll lose everything. They're not doing this behavior on purpose. They're simply doing what their brain tells them is logical and makes sense. And that's not logical anymore. They also begin to lose executive function, which is our ability to plan complex tasks out. So a complex task, Glenda, that involves executive function is, I want you to come over for dinner tonight. So I must remember to invite you, make sure you can come, agree on a time, decide on what we're going to eat, make sure that I prepare that, have it ready when you get here, that I have plates and forks and all the stuff we need, and that we have dinner. That's executive function, this person is beginning to have trouble doing that. Then there's that impaired visual spatial ability. It's the person not being able to find where they are, even though they're in a familiar place. A woman called me last week and said she got a call from her mother's friend. Her mother's friend went with her old best friend in Dallas on their way to Neiman Marcus, and the mother got lost on the way there. But the friend said then the mother figured out how to turn on the navigation in the car. They eventually got to Neiman Marcus, and when they got there, the friend called the daughter and said, "Can you come pick us up when we finish shopping? I will never get in a car with your mother again."
Oh, wow. Wow.
That right there would
Yeah.
and the daughter called wanting to know if she should take the keys away. Like, no, I think you should get in with her and ride around. So it's getting lost in familiar places. And Glenda, that can mean my neighborhood. I can't tell you how many times a family has said that they believe their loved one knows to go only to that corner and then turn around and come back home. And the reality is that is simply not true. This is brain damage.
No.
There begins to be difficulty recognizing common objects or people, who those faces are in the family. And that doesn't mean my grandmother and grandfather. That means my grandchildren, my great-grandchildren, my children. Difficulty finding objects right in front of them. My grandmother would say, well, if it was a snake, it would have bit you. It's sitting right in front of you and they're not able to see it. Then there begins to be more and more trouble using simple tools. They use a fork to eat soup with. They use a spoon to eat something we would use a fork with. Clothing isn't correct on the body. They may tell you that they can't put on this pair of pants because it only has one place for legs. Their shirt can't figure out how to get their arms through their shirt. Someone has stolen their shoes even though they're looking at their shoes. The shoes are on the wrong foot. They put on shoes but not socks. And then difficulty orienting their body in time and space. So people with dementia tend to be bruised from their shoulders down to their knees with little bruises that are caused by bumping into the sides of tables or chairs or doorknobs or doorways or couches or coffee tables or end tables or beds. They bump into stuff because they don't see things correctly. And then impaired language, trouble with writing or speaking, reading and comprehension, difficulty with common words, hesitating when speaking. And now, Glenda, I hate to do this one because, you know, how many times today have we forgotten a word, forgotten a name, started to use a word, decided that was the wrong word, used another word, whatever. We all have those word issues. That's normal. Some of us don't remember people's names. That's normal. My brain decided a long time ago, it doesn't care what your name is. I don't remember names. But this is something different that you notice about your loved one. And one of the ways that this gets missed, Glenda, is I like to read. So I still carry a book around and I open it up and I look at it and my family is convinced that I'm still reading it. And I convinced them because they said, can you read those words? And I read that sentence to them and they think that actually means I understand that sentence. So comprehension is lost. And then the hesitation when speaking, you're under stress. If you're a dementia caregiver, either professionally or as a family caregiver, tremendous stress. If you're a professional dementia caregiver, we're now beginning to worry about PTSD for what has happened over the last 3 years. But this is going to be errors in speech, spelling, or writing that are different and that are new. And what you've got to determine is, am I reading the newspaper because this is just a normal activity I did every day over my coffee? And am I really understanding it? Or am I simply saying a few words out loud now and then? And the next one is this, that there are changes in personality, behavior, comportment, the way this person normally carried and behaved and saw themselves. So this is mood fluctuation, agitation. And remember, vascular dementia has a more verbally and physically agitated appearance as opposed to other forms of dementia, although we certainly see agitation. But a loss of drive, social withdrawal. And one of the social withdrawals that people sometimes miss is by stage 5, which is when most people in this country are diagnosed, the person's lost about a half a pound of brain tissue. They have the mental equivalency of a 12-year-old, but they still don't look sick yet. By stage 6, by the middle of stage 5, they have the ability of an 8-year-old and they still don't look sick yet. And by the end of stage 5, beginning of stage 6, where they will finally look physically ill, they have the ability of a 4-year-old. And so as this stage 5 progresses, there's not only a dramatic change in the person's mental ability, but that equals a dramatic amount of brain tissue loss. And one of the things that happens in that loss is the loss of the ability to understand what's being said to me. Now, 90% of communication is done without language. It's my tone and pitch of voice. It's the way my face looks. We've been hampered professionally by having to wear masks, and we're still in mask in our licensed communities. So we haven't been able to express ourselves that way. But normally, it's the look on our face, our pitch and tone of voice. But in stage 5, Glenda, the person at the beginning understands 3 out of 4 words. By the end of stage 5, they're understanding 1 to 2 out of 10 words. So some of this agitation, this change in behavior, is being caused by us, the caregiver, because we don't realize this person doesn't understand what we're saying anymore. And as humans, we give people 2 shots at information. So the first time I say, when's my doctor's appointment? You say, oh, it's at 3. And the second time I ask you a few minutes later, you say, it's at 3. And the third time I ask you, when is my doctor's appointment? You say, I already told you. And now you've communicated to me I'm in trouble. But what you've got to constantly remind yourself of, I'm not doing anything on purpose. So when you see changes in behavior, you have to ask, is this dementia advanced to this stage, or is this me not understanding my loved ones doing the best they can? In this area, we also see compulsive and obsessive behaviors. And Glenda, that's where we go in and we find where the toilet tissue's been taken apart, tissue by tissue, and neatly folded and put in a drawer. Kleenex is taken out of the box and neatly folded and put in a drawer. Socially unacceptable behaviors, saying what they think in public the same way a 4-year-old might. Those are all indicators of brain damage. People disrobing in public, people shoplifting. All of those are things that can happen in certain forms of dementia, and they're an indicator of brain damage. So to make the Alzheimer's diagnosis, and this is also part of the testing that's done to rule out Alzheimer's, is CT scans are made using x-rays and computers that make horizontal slices of the brain and allow the doctor to make comparisons, versus the MRI, which is using large magnets and radio frequencies to make a very detailed 3-dimensional picture of the brain. The PET scan is using special tracer materials to light up regions of the brain, and those regions tell the neurologist where the brain is damaged or where the brain is about to be damaged. The EEG measures electrical activity in the brain, and so Glenda, if there's an area of the brain with no electrical activity, that's an indicator that that area of the brain has died. And then neuropsych testing is done to begin to make the assessment and differentiate between vascular dementia and dementias of the Alzheimer's site and Alzheimer's type. And then the neuropsychiatric evaluation again is done to rule out any psychiatric condition that may appear to be dementia. And the most common one is depression. So depression among people, especially older people, causes us to look and feel as though we have dementia. Neuroimaging, the MRI is done so that the radiologist and the neurologist can look to see if there's any evidence of stroke, tumor, lesions, or atrophy. And the MRI has a setting where it allows the physician to make a measurement of the amount of volume loss and atrophy in the brain. And that's why your summary page from an MRI will talk about atrophy and volume loss, because it's telling you how much brain tissue is no longer there. And then PET scans measure the metabolism, and they measure and help the neurologist make the decision that your loved one has now moved from stage 2, which is mild cognitive impairment, into stage 3, where the word dementia would be used for the first time. And then the spinal tap test, Glenda, is done to draw spinal fluid. And by measuring the levels of tau and some other proteins that are in there, it allows the physician to differentiate between whether they're looking at an Alzheimer's or another form of dementia. The genetic risk factors are that it's a first-degree family member who absolutely positively had Alzheimer's. Now, one of the biggest things I hear is my great-grandmother had Alzheimer's, and my great-grandmother had Alzheimer's, and my grandmother had Alzheimer's, and they probably didn't. They probably had some sort of vascular dementia. And the reason for that is Alzheimer's was considered very, very rare, and we had no medication at all for vascular diseases, so people developed vascular dementias. Most of the cases of dementias of the Alzheimer's type are considered sporadic. Gene changes like the APE4, a lot of these gene changes can show in testing, but there's no way to tell you whether or not if you have those, it will actually become Alzheimer's or whether it will just be dormant. So I wouldn't want to know, Glenda, because I don't want to spend the rest of my life walking in a room and not remembering what I went in there for and thinking, oh, it started now. So a lot of physicians will not test people genetically because it's not known if you carry this, does it actually turn on or not, because it's known that in people it doesn't.
Can I ask you a question real quick?
Yeah, I was focusing. You scared me half to death. Yes, ma'am.
Unfocused. So those of people of a certain age, like my age, I'm 75, remember a time when people were called senile.
That was Alzheimer's.
That fit into this. That was Alzheimer's disease. Okay.
That was Alzheimer's, and hardening of the arteries was vascular dementia.
Okay, got it. Thank you.
And that was it. You either had senility or you had the hardening of the arteries. Now, if you have a doctor today who's using the term senility, you need to get a new doctor, because that word has not been used in medicine for 50-something years. So run away. So dementias of the Alzheimer type are considered acquired cognitive and functional impairments resulting from the effects of failing and dying brain cellular structures. So what that means is Alzheimer's causes brain cells to die, and the behaviors and changes in cognition and ability of your loved one, and that includes everything from knowing who you are, to knowing language, to being able to move the body, to recognizing the bladder or bowel need to be evacuated, to understanding how to do IADLs, ADLs, to be able to chew and swallow food, are all run by the brain. And so as the brain dies, the body's ability to do those functions changes until eventually the person cannot. Dementias of the Alzheimer's type also affect children, young adults, middle adults, older adults. And for children's dementia, there's about 70 different syndromes that are called children's Alzheimer's, but they're all very, very rare. Mild cognitive impairment is what you and I would call stage 2, Glenda. This is where the disease begins. And in most people, they might tell their spouse something's wrong with my brain, but then they quickly dismiss it and they move on. And if you mention testing, there's a reason why they don't need testing. They're really fine. And so nothing happens. And then it becomes dementia, which is stage 3 on your staging tool. And it is thought that this stage of dementia is actually about 2 years long, and the disease now begins to spread into the temporal and parietal lobes. And so now you're starting to see some small changes in object recognition, direction sense. A lot of times families will tell me they realized something was wrong with their loved one because he always knew how to drive in every city on vacation, and they went somewhere that he'd actually been before and he got lost. So that early sense of direction loss is frequently a sign for a lot of families. Stage 4 is called moderate dementia, and moderate Alzheimer's means that there is now some structural damage to the brain. There is now tissue loss in the brain. The disease has moved into the frontal lobe. So now you're beginning to, if they think it, they say it. We always make a joke about if you want to know, do I look good in this dress, wear it to a dementia community and they'll tell you, you look awful. If you think, do you have a stylish haircut? Go to a dementia community and ask them, and they'll tell you your haircut looks terrible. So you're beginning to hear them say what they think. And then severe dementia, that's a little misleading. It's actually broken into moderately severe dementia, and very severe dementia. Moderately severe is stage 5, severe dementia is stage 6, and very severe dementia is stage 7, which is the bedbound stage. And at this point, this is now beginning to enter into stage 6. The disease does enough damage in the occipital lobes that some people will lose vision in their left eye as a result of the loss of connectivity between the right occipital lobe and the left eye due to the amount of damage in this lobe. When you and I make memory, Belinda, the brain gathers the stimuli around us. And that stimuli from our ears as it moves into our brain, from our eyes as it moves into our brain, as it goes back through the white matter and goes up into the brain, the hippocampus and limbic system decide, hey, that's information we want. We're going to keep that. And so the hippocampus then begins to form new chemicals, and it sets up a structural system of highways. And those highways are different for different areas of the brain. We absolutely don't understand how these are done, but we realize that the hippocampus sets up these structures, fires those neurotransmitters, those chemicals, with electricity through that system into that particular group of cells in that particular area of that particular lobe, and it makes those neurons grow, and you and I learn that information. And that's how we learn information. But once this area becomes damaged, then it doesn't matter how many times you tell me the name of the new baby, I can't learn the baby's name because this piece is gone. In the parietal lobe, which is body temperature, taste, and smell, there begins to be impaired tactile sensation, although tactile sensation does remain until the end of life. It's just that the shower that feels so good to you and me, to a person with dementia, may feel like 1,000 stinging bees. And shoes which feel wonderful to me may feel weird on my feet, so I take them off because the nerves on my feet are still working. Some of the odd forms of Alzheimer's, posterior cortical, it actually makes the skin feel like it's tingling or it's being pinched. So there can be a change in tactile sensation and an impaired ability to sense self-movement. So a person with dementia may be moving without realizing that that arm is moving or that leg is moving. The ability to read, write, and do math. The loss of ability to find a defined space. So where is my room, Linda? Where is my room? Where is my room? I don't know where my room is. Where's my room? It's not purposeful stuff. It's an indicator of brain damage. Can't find objects anymore based on touch. So, Glenda, I could hand you a brush, a hairbrush, and you could tell that was a hairbrush with your eyes shut. I could hand you a toothbrush, and you could tell me that was a toothbrush with your eyes shut. But a person with dementia begins to lose the ability to do that. And then there begins to be neglect in that I can't see, feel, I'm not aware of certain parts of my body or the environment. And the environment means I'm going to bump into stuff and get little bruises on me. The other means I'm no longer clean shaven, but I think I am. I've got whiskers, but I don't realize it. I can't do the things that I would have normally done that put myself together in that finished place because of brain damage here. In the temporal lobes, which are automatic yes or no, remember that's over here with singing and cursing, there can be tinnitus or auditory hallucinations. And we know about tinnitus. We don't hear a lot about auditory hallucinations, Glenda, and it may be that the staff is not paying enough attention because of being overwhelmed, overworked. Nobody's told them to watch for this. So I've never been told about this, but common sense tells me it has to be happening. A loss of ability to comprehend music or language, but music is lost after language is lost, overall memory loss, complex hallucinations. And so this is why The hallucinations can have so much detail in them is damage here. Not just a bad guy coming to get me, but actually describe for you what the bad guy is wearing, what he's doing, what he looks like. They can have seizures and then difficulty with language or singing. The frontal lobe, you'll see that unsteady gait. And it begins, they're not lifting their feet as high. And so one of the things that I practice, and I'm 60, is I practice to make sure I lift my feet. And I actually do that by walking through the pasture where I must avoid rocks or else I'll fall and kill myself. So in dementia, because of damage in the frontal lobe, and it's because the top of that blue frontal lobe is where your motor cortex and premotor cortex are, that's why you begin to see this unsteadiness and this inability to move the body correctly. This is not somebody who needs PT. We have to recognize this person's not moving their body, not because they're trying to be bad, but because of brain damage. And we've got to stop trying to make them get up and walk. Do you see how that makes no sense, Glenda?
Yeah.
Yet I could walk into any nursing home today and I would find somebody with advanced dementia who's being held up by people and forced to try to move their body. And how in the world can they do that? Because these pieces are gone. There can be limb paralysis, trouble with impulse control, an inability to express oneself linguistically because speech is in the frontal lobe. Changes in facial recognition because the facial recognition for the family is in the frontal lobes, the temporal lobes, and the occipital lobes, and those lobes are all damaged now. Changes of the ability to smell or have rational thought. And rational thought, Glenda, is when it doesn't exist, I can't find my purse, but you're here. So rational thought tells me you must have taken it, even though that's not rational.
Yeah.
Does that make sense?
Mm-hmm.
And then there can be the reappearance of primitive reflexes, which is the movement of the nose, snouting, grasping, and then holding on to somebody very tightly. And those are just an indicator of how damaged the brain is. As the occipital lobe becomes more and more damaged, there's a loss of vision and visual fields, and then a loss of vision with denial of loss. And so the person will insist they can see even though they can't. And then there can be a loss of vision on one side. It's typically the left side. And this has nothing to do with glasses, Glenda. This has to do with brain damage. And then visual nausea, the inability to recognize things that you're seeing. So they don't recall familiar objects. A hairbrush and a toothbrush might seem like the same thing to them. The faces they don't recall, it's not you and me, Glenda, it's their family members. And colors. People with dementia don't see colors the same way you and I do. And if you'll watch, older ladies tend to dress most in purples and reds because older ladies see purples and reds better because of how bright it is. And then objects can be smaller or larger than in reality. So if I brought my puppy to come visit, that lady may think that's a really large dog. Another person may think it's a tiny, tiny thing. And then they may see weird zigzag light flashing in front of them, and that can make them disoriented. And then the vision changes from 3-dimensional to 1-dimensional. And so remember, in the vascular families, it's different than in the Alzheimer's families. And Glenda, we know that the Alzheimer's family gets more support because of just a better publicity about Alzheimer's. And Alzheimer's has this steady progressive decline. The vascular families see a person who's totally different. Their hippocampus may not be damaged. So they're told they have dementia, but they're not seeing their friends, their loved one behaved the way their friend's loved one behaved. He went in this very strict Alzheimer's pattern, but their person is stabilized and has moments where they remember stuff, but then moments where they appear very declined, and then moments where they appear like everything is normal. And while the Alzheimer's person goes down the slippery slope, one decline after another, the vascular person stabilizes and then has another series of events and steps down. So they stair step through the stages. And so for the Alzheimer's family, there tends to be more support and understanding of what's happening with their person. For the vascular family, there tends to be less support and less understanding on the family's part of what is wrong with my loved one because they don't act like the other dementia did. Does that make sense?
Yeah, we just have to remember they're all diseases. It's not somebody just acting out.
And this is just an animated slide to give you an idea of how complex a couple of neurons are.
Mm.
It is not that simple cell structure we grew in school. It is an incredibly thick, detailed, continuing to grow, always getting thicker and richer, incredible organ system that we fully don't understand. And as it dies, tiny bit by tiny bit, your person's behavior changes, but it's nothing intentional. So in the dementias of the Alzheimer's type, there are approximately 70 different syndromes that occur in children, and they are referred to as children Alzheimer's. And Glenda, you and I have never seen this because a parent would have cared for this person. The next form is early onset Alzheimer's dementia. And this is the one that really scares people because they know it has a familial component. But Glenda, it's now believed that the people who actually inherit this are about 5% of all the early onset Alzheimer's families. So it's not a very big number, not to take away from it, but it's not that big of a number. The typical onset is in the 20s, 30s, 40s, or 50s, very, very aggressive, inherited from the parent. And in this little 5% group, it is believed that they all come from the same valley region of Germany, where there was a genetic mutation that obviously occurred decades and decades and decades ago. And there's been one other place in the world found, and it was a place in Central America that had this same genetic thing. And what people began to think was, after World War II, Germans escaped to South America and Central America, and could this somehow be related? So there are people actually doing research on that. The largest form of the early onset Alzheimer's is sporadic. No one in my family has a history of dementia of any kind, and suddenly my 35-year-old sister is diagnosed. So it's that type of thing. And it is very, very aggressive. Remember, in any dementia, the younger it is, the more aggressive the dementia is. Now, this is a famous picture of a family from Beaver County, Oklahoma. And what they're famous for is that this is a group of siblings, and there's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. 12 of them died of early onset Alzheimer's. They are one of the families from Germany. And one of the cousins or grandsons is a psychologist, and he wrote a book called The 1,000-Mile Stare, like staring off into the distance, because that's how they referred to this family, that they were really nice people, but once they turned 40, they all went crazy and you wanted to stay away from them. And this is a very famous family studied. This is there's a 4-room hotel there in town, Glenda, and the CDC have all been there because this family has been studied for decades. There is logopenic variant Alzheimer's. This is extremely rare, and this is an atypical presentation of language loss that varies from the form of frontal temporal dementia communication disorders. So there's a very, very rare form of Alzheimer's that also involves a very atypical presentation of speech loss, but it's most commonly misdiagnosed as an FTD. So there are very rare forms. We have Down syndrome Alzheimer's, and this causes sudden changes in personality. The person becomes verbally and physically very agitated. They begin to refuse to perform their ADLs. They can get very aggressive. And this is especially emotionally challenging for the family and for the staff, because again, these tend to be younger folks, people in their 40s and 50s. Regular onset Alzheimer's dementia is people in their 60s and 70s, and it's now believed that the disease was present 20 years or more before symptoms begin to show. I've seen some research indicating maybe it begins as early as a person's 20s, but it takes 40 years to show damage. We now know that it is predated at least 10 years by depression, and that depression goes untreated. So it is critical that if you fail your depression test, which is the geriatric depression test, that you get treated for depression, because it is believed that this link of the failure of serotonin, which is the main mood neurotransmitter in your brain, And when serotonin's out of balance or not used correctly, that's what causes depression. That if that goes untreated, that somehow feeds into dementias of the Alzheimer's type. The failure of the proteins is not yet understood. What causes tau protein to fold differently? What causes the APOE4 protein to begin to do its stuff? There are human trials underway. There are human trials underway here in Austin, and there are human trials underway around the world. Unlike any other disease, universities, medical schools, research facilities are sharing information. People are just focused on different minute things of the brain, trying to find out what the link is, what the connection is. For people now in our country, death typically occurs within 5 years of diagnosis, and it's because people are not diagnosed until the disease is already advanced to stage 5. So they're in the final part of the disease anyway. Regular onset Alzheimer's is very subtle. It's progressive. It is often misdiagnosed or not diagnosed because the doctor doesn't see it. And this can be very irritating. Glenda, if I went to the doctor and said my big toe hurts, they'd send me to a podiatrist. And if I went to the doctor and said I've got a spot right here, I go to a dermatologist. But if I say my heart hurts, I go to a cardiologist. But if I say my brain, which runs my whole body and is the most complex organ we have, suddenly everybody's an expert. And I need to be seen by an expert, which would be a neurologist specializing in dementia. So it gets misdiagnosed. Most of the thing I see when I look at charts is everybody either has Alzheimer's or they have dementia with or without behaviors. And it can't be 100% of the diagnosis, so somebody's wrong. So we have to go back and find out which one it really is. Families may literally miss the clues until stage 5 of the disease because you were busy, because that person had retired, but you still worked, because you worked the night shift and they were awake with an adult son who lived with you and they watched them during the day when they were actually sleeping from their night job. So there could be any number of reasons you didn't see it, but still most people are not diagnosed. There are cortical subtypes of atypical Alzheimer's, and atypical means this one doesn't follow the same course as the rest of them. Posterior cortical atrophy is rare, but it is especially damaging. It causes the person to slowly go blind. So in addition to all the other damage that's occurring in their brain, they're losing their ability to process visually what's around them. And this person feels nauseous. They have terrible headaches. Their skin feels like it's being pricked. They have dizziness and language dysfunction very early. Frontal variant Alzheimer's is frequently misdiagnosed as either vascular dementia or behavioral variant FTD. But in behavioral variant FTD, the person is gaining weight rapidly. In frontal variant Alzheimer's, the person is losing weight. And very quickly, they become paranoid, irritable, and there becomes a neglect of personal care and a decline in social conduct. And those things are telling you that there is significant damage in the frontal lobes, because the frontal lobes are what control compulsive behavior, personal care, and social conduct, irritability, and paranoia. Others progress at a very regular rate of decline or a slower decline. So late onset Alzheimer's, we think of as people in their 80s and 90s. And remember, by the 90s, the odds are 1 in 2, but it is a slow progressing form of Alzheimer's. And one thought is perhaps it's metabolism. The younger a person is, the more aggressive the dementia is. Perhaps the older it is, the slower it is. Late onset Alzheimer's, the person is more likely to die of heart attack or stroke because they are of such a great age, or the death may be the death from dementia, which is aspiration pneumonia, sepsis, and renal failure. And that is caused by actually living into stage 7 and swallowing food particles into the lungs. The family fear in very late age dementia is that this person will live for several more years, but if you follow your staging tool, it will tell you people in stage 6 don't live 5 more years. People in stage 7 don't live more than 2 years because the brain runs the body and there's just such significant brain damage. And the diagnosis can be wrong. If you see behaviors that you know look like Lewy bodies, you've got to bring that up. Doctors make mistakes. And if Alzheimer's is only 40% of the dementias, then an awful lot of people are being told they have Alzheimer's when they don't. So feel free to question, how did they arrive at that decision, and look to see, was any of the testing done? And then remember, if it was cancer, so many of these conversations we have, you wouldn't have to have. If the word had been cancer, you would have known the questions to ask. If the word had been cancer, you would have been a caregiver 2 years. If the word had been cancer, you would have understood what they were talking about. You've not been a bad person during this disease. You've done the best you can with a major disease, what to me is a major health risk, and nobody's given you any information on it. You're not bad. It's just, this is truly a horrible disease. There are hard conversations you have to have. Glenda, you and I both know the person with dementia doesn't look ill until there's a pound of brain tissue loss. And you go to visit a community to start trying to think about the eventuality of care, and you will be convinced your person doesn't look like those people. And part of that, Glenda, is our heart. It's our emotion. When I look at you, I see your eyes. When you look at me, you see your eyes, and we forget to see what the disease has done. And even though in stage 6, it will begin to ravage the person's body, in earlier pictures, you can see a change, but you have to go back several years and look. When I asked an audience to do this a few weeks ago, Glenda, a woman sent me a message as soon as it was finished and said she went back and looked at her husband, and she realized in none of those pictures was he smiling. And the closer he got to the end of life, the more she realized there was a vacancy in his life, in his eyes, and a vacancy on his face. So you do have to go back and look and pay attention and realize if your person's in stage 5, they really do look like those other people. I'm sorry, did that make sense, Glenda?
Yes, it does.
Okay. Remember, people with dementia need care, and the care is based on their need, not yours. And we know that people with dementia get better care in professional care because they're surrounded by nurses. The doctors come there. The staff is licensed. They're all prepared and trained on how to watch for UTIs or strokes or pneumonia or changes in status. And so we do know that it's a medical decision you're having to make. So talk to your doctor about you. Treat yourself for depression or for anxiety. Walk with a daily goal, Glenda, of 4 to 8 miles. And I know you do that. Stop eating in front of the TV. I'm terrible about this. And stop thinking that something being wrong with your brain is normal aging, because it's not. It involves the 2 ugliest words in the English language, diet and exercise, Glenda. That's really the route to healthy aging. And then meditation. Meditation is the best thing for your brain. And by meditation, we mean breathing meditation. And realize that this is very complex stuff. Understanding dementia is complex. Understanding any of the dementias is more complexity. Part of this has to do with your race, your sex. Women are a higher risk, but we're a higher risk for Alzheimer's because we live longer than men. There are more of us. Habits. There's a difference between the person who's a social drinker and the person who drinks a case of beer a day. And you can be this big around and run marathons and have high cholesterol because you inherited it. So there's things we can control and things we can't. I have a friend, Glenda, that when she moved, she made sure that the trash can was in the laundry room, because every time something had to go to the trash, she had to take 12 more steps in there and 12 more steps back. And she said, look at how many steps I will take in a year just by doing that. So it's making little tiny changes, bit by bit by bit. Change your plate size. Start eating out of the salad plate instead of the dinner plate. When my grandparents were growing up, the salad plate was the dinner plate. I know a man that every time he does something, he runs. He runs to it. If his wife says you left something in the car, he runs all the way to the car. So walk, bend, reach, move, do Tai Chi, do yoga, keep moving, do chair exercises. Glenda, I knew an activity director once, had to do chair exercises every day for an hour with the residents. She lost 60 pounds. She was absolutely thrilled. Try to quit smoking. Smoking is the most addictive drug we have is nicotine, and it's legal for you to buy, and there's no rehab. We don't send you to rehab, we just tell you to stop. Talk to your doctor, use the medication, get off of that. And remember, it comes back to diet and exercise. A whole lot of it is diet and exercise. Now, you got the Mediterranean diet. I thought it meant we were going to live in Greece under palm trees and drink red wine. It's not what it means. It's a specific diet of vegetables, fish, olive oils, light meats, lots of vegetables and fruit. The diabetic diet is very, very good. It's controlling sodium and sugars. Move your body. Try to stop smoking. Try to stop drinking as much. And I say that, Glenda, with Texas leading the country in drinking during COVID. Go Texas. Stay mentally active. And we know it's important that you continue to make younger friends. We know that's important for all of us as we age, as strange as that sounds. Now, I do have a diet tip for you, Glenda, and I want to share this with you because I think it's important. A cardiologist told me the diet that he gives to every successful patient of his. And do you know what it is? If you put the food in your mouth, Glenda, and it tastes good, you should spit it out. That's his diet for his cardiology. Yes, if you taste the food and it tastes good, spit it out. It's got something in it that's not good for you, probably butter or salt. So remember, human evolution is very, very slow. And in a century, we have gone from people who routinely walked 8 miles a day or more, people who consumed about 1.5 pounds of processed sugar a year, people who ate freshly grown foods, people who ate much smaller portions in spite of the amount of work they did, to we move 80% less than our grandparents of the great generation, but at 60, I still move more than today's teenagers. Today's teenager is eating 154 pounds of processed sugar. And we believe that when this generation reaches their 30s and 40s, we will see aging go backwards for the first time in 300 years. And a large number of this group will actually die of diabetes and diabetic complications in their 30s, 40s, and 50s. That makes you feel better, doesn't it?
Nope.
We are at present the most overweight, overmedicated, and least moving people in history. And we know that all of this has to do with our brain function. We know there's a connection between sugar. Probably it's that we don't need to have the amount we're having. And it means we got to take better care of ourselves. Okay, so remember your breathing is into the count of 4, hold for the count of 2, and breathe out to the count of 6. And that helps you slow your brain down, and slowing your brain down to breathing and the meditation breathing means your brain makes greater connections. It clears itself of toxins better. It makes your brain thicker and richer, and it is the #1 exercise for the brain. Okay, I should have depressed everyone by now. That is always the goal we're shooting for. So
you got me on the spitting out the food. I was fine till you got to that.
It makes sense though, doesn't it? Everything you taste
Yes.
good, that tastes really good is bad for you.
Yeah. And one of the things that Tam has always told me, because she knows I love this, it's a dance, because that engages your brain and your body all in one thing. So remember, dancing is fun, and do that.
Dancing is the #1 physical exercise. Your brain must move large muscle mass in time to music. And Ginger Rogers did everything Fred Astaire did, but she did it going backwards wearing high heels. Why didn't she get the Oscar? That's what I want to know.
Exactly. Okay, well, let's get to a few questions, comments. Tani, I appreciate your patience. She asked a while back, once a dementia patient begins having detailed hallucinations where they are seeing, hearing, and feeling, provided they aren't caused by another thing like a UTI, is that level 6 or stage 6? They're hallucinating.
Well, it would depend on what the hallucinations are. If the hallucinations are children, bugs, spiders, rats, and snakes, bad people coming to get me, or everybody around me is having sex, then that is actually Lewy body dementia, and the doctor would need to know. Other things that families might see and think of as a hallucination is as people get near the end of life, they most certainly begin to talk to people that they don't know that are telling them it's time to come on. And they also have conversations with people they do know. So we hear them talking to grandparents, to spouses, to parents. That is a common thing. So it would be a question of, are we dealing with a different dementia? Is this somebody near the end of life? or is this a perception issue? A perception issue, Glenda, is the car drives down the street, causing a shadow to go across the windows and the curtain. Your brain sees that and looks at it and goes, huh, car, shadow, curtain, and dismisses it. But a person with Alzheimer's might look at that and insist that there's a person standing at those curtains. So that's a perception issue, not a true hallucination. So you have to first determine, what are you actually dealing with? A hallucination, a Lewy body's hallucination, or a perception issue, or an end of life.
Right. So I hope that helps you, Tani. The other comment I wanted to make is that not all neurologists are equal. And you said you need to find somebody that specializes. I heard of a person this week that's in the hospital with a UTI, and the doctor told her family that she has dementia, but when she goes home, it'll go away. I was floored by that, but it just reinforced.
Wow. Maybe they meant the UTI will go away.
Exactly. So I counseled the family on what I've learned from you, Tam. Thank you so much.
You're so welcome.
If you have a question or a comment, you can unmute your phone. And if you called in, that's *6 on your phone. If you're on Zoom, you can raise your hand. You can unmute your phone also, and I'll call on you either by your area code or by your name if you're on Zoom. Or you can put something in the chat box like Tani did, and we will answer that as we go forward. I cannot believe that nobody has a question or a comment. That is so unusual. So let me look. Oh, I also talked to a person this week early on in the conversation today. You talked about COVID and some sort of dementia. I talked with a friend I hadn't seen in a while, and she told me that she had had COVID in the very beginning, which means she had the severe form of COVID. And she said she has not been right since then. And that's the way she described it in her mental faculties. She said, it's nothing I can put my finger on, but something is changed and it's staying that way. So
it is, research was released about 3 weeks ago that indicates there are specific areas of the brain that seem to have been damaged, even if you had mild COVID. And the prediction is that these areas of the brain are going to begin to age abnormally. And instead of, say, 0.02% aging per year, these areas may be aging at 2.0% per year, which means in 5 years, that'd be 10% brain lossage. So the only thing that we know that will repair something like that at present is actually breath meditation. So the full trying to stay focused breathing meditation, because it enacts the plasticity of the brain and it rewires the brain and makes new connections in the brain. So it's thought that that may be the treatment, but there hasn't been any other news out there on it. Also, it takes a special MRI using rayon gas in order to be able to see the scar tissue that has been left in the very fine capillary area of the lungs where oxygen begins to be moved into the blood supply. And those are the areas that were attacked by the ACE receptor cells and the COVID virus. And so when they realized that it was only through this method they could see that, what is being recognized is people have significant scar tissue there, so they're not getting enough oxygen through the day, and that's why they feel fatigued, but that's why they are not thinking clearly, is this virus has done more damage than there's been time to actually research, but it is, it's scary. So I encourage everybody to do meditation.
I will share that with her for sure. Jamie said, can it, and I know the answer to this, but I'm setting you up. Can an injury to the head lead to a form of dementia?
Well, a injury could, it would be a traumatic brain injury. So a person could fall off of something high enough and have a traumatic brain injury and have a dementia as the cause of that. A soldier could have been exposed to multiple IEDs. And the explosive concussive effects on their brain means that we've got young people with dementia who are in the military, who are in their 20s and 30s, who have dementia. And then we have the 9th most common dementia is chronic traumatic encephalopathy, that is football dementia. And you have pugilist dementia from people who did boxing. So one single traumatic blow, the right blow, big enough, large enough, would start dementia. And then other things that could happen. Now, if you had a concussion in a car wreck when you were whatever, your brain has something called plasticity and it has recovered from that. But a large enough blow, a significant enough blow, or enough different blows would cause a dementia.
Okay, and then Linda says, can vascular dementia be treated with dementia medications too, or is the best treatment those that help circulatory issues?
They originally thought that they would not use Aricept, Razanine, or Exelon in vascular dementia. And then neurologists who specialize in dementia begin to try it out anyway, and it didn't seem to have an adverse effect, and many reported that they thought it had a positive effect. So we know that in any dementia, if you have the dementia long enough, Alzheimer's will join it. So in vascular dementia, you would certainly now almost begin to look at it as a way to help the person stave off Alzheimer's or keep the Alzheimer's from progressing as quickly, but it is used now in vascular cases as well.
Okay, Linda, thank you for that question. Linda Arias, you had a question or a comment? Please go ahead.
Yeah, I do. I was just curious. My mom's, they say she has Alzheimer's, dementia. My uncle had it. But she's towards the end where she can't eat very good. She can't walk. She can't do anything. And she's got that blank stare. Is there any way to find, I mean, I don't know what kind of Alzheimer's or dementia she has, but I guess it doesn't matter now, but it would be interesting to find out because we can't really move her at all. Can you still get a diagnosis on that?
Well, it sounds like somebody should be in hospice care and in a skilled facility. The person you're describing is somebody very near the end of life. And so what you would do is you would take away the dementia she could not have, and let's look at what she's left with. So how old is she?
She's 84.
So did she ever play football?
No, but they said
Does your family have Huntington's?
No.
Did your mother drink?
No.
Does she have Parkinson's disease?
No.
She's too old for FTD. Does she have any of the hallucinations? Children, bugs, spiders, rats, and snakes, bad people coming to get her, people having sex around her?
She did have hallucinations and it was aggressive, but not anymore.
Okay, these would be ongoing hallucinations, and they're not necessarily aggressive. They just would be daily happening for hours. So you're not seeing those?
She does. Yeah, she has them.
Which ones does she have?
She will look at things or point at the window and say, "Oh, look." But that's all she can say, but very distant look in her eyes, very.
Okay, when she had language, did she see hallucinations and talk about seeing children or bug spiders, rats, snakes, bad people, or people having sex?
Bad people, yeah, that they're coming to get her.
Okay, so then you would put a check by Lewy bodies for your mom. Be very sensitive to medication. She would have had unusual falls. She would kick and punch in her sleep. She would have had moments where she seemed perfectly normal, mixed with moments where she just seemed like she just had something just in a completely different world. She would have known y'all up until the very end. And so that's would be a big marker for that one. And then the next thing would be, has your mother had any documented strokes?
No.
Has she on high blood pressure medicine?
No.
High cholesterol medicine?
No.
Had a heart attack?
No.
Had any kind of heart surgery?
She had back surgery, and they said once she got the anesthesia that she will not remember as well, but I don't believe that.
Okay, so she's not had heart surgery?
No.
Okay, so you can, and not a smoker?
No.
No COPD? No sleep apnea? So you would rule out vascular dementia, and that now brings you to Alzheimer's, and you said she's how old?
She's 84.
84, her odds would be 1 in 6 of Alzheimer's, and you've already described what sounds like Lewy bodies. So that would put your mother at Lewy bodies with Alzheimer's, would be your
Oh.
best guess, and there would be no reason to take her anywhere for testing. You've already said she's near the end, and you just want to keep her comfortable.
Yes.
But you rule out the ones that she can't have, and what you're left with. And Lewy bodies has such distinctive markers that if you see those things, it's Lewy bodies.
Oh, thank you.
Okay.
Thank
Sorry
you,
about
Linda.
your mom.
Thank
Yeah,
you.
absolutely. Our condolences for what you're going through. And I hope that you listened carefully to what Tam did with Linda. She worked through a process in order to eliminate those types of dementia that she could not have. And one of Tam's earlier sessions, she showed you how to do this. And so we're talking about podcast recordings of sessions. That would be available on the www.caregiverteleconnection.org website. So you can go back and she instructs you how to do that process as you heard her do it with Linda today. So it's an important process. And one last question. Stephanie asked, is memory loss a normal part of aging? And you talked about this, and she may not have heard that portion of your discussion.
No, it's not. Most of us learn at the age of 80 the same rate we learned at the age of 20. It is keeping your brain healthy and active. So get the book called The Mature Mind by Dr. Cohen. It is one of the few books written about how the brain normally ages, what most of us will experience. And then when you finish reading that one, get his other book, The Creative Age, and it'll just make you feel so good. But the normal aging process is our brain gets thicker and richer as we age because we have more life experiences. We have more things going on. And then it has to do with what your life experiences are. Glenda is a mother and a grandmother. I've never had children. Glenda has a whole set of files in her brain. I don't have it all because I never had those things. So the brain becomes thicker and richer as you and I age, as long as we take care of it. And, you know, that involves those two ugly words, diet and exercise. I was trying to take diet. I was going diet and medicine. I was like, no, not medicine. It's not medicine. It's exercise. Yes, yes.
All right. I can't resist this one last question. It's quite involved from Tawny again. My mom sees people, children and adults. Most are friendly, but some frighten her, like the men who sit on her bed. There was one where she thought she was on a carousel and was going around and around. Another was when lying in bed, a box was coming down trying to squish her, making it hard for her to breathe. Another was there were ropes pulling her up. She's been diagnosed with vascular dementia, and now the doctor says she has Alzheimer's.
I would document the hallucination behavior, and it really has to be a neurologist specializing in dementia. Most neurologists don't study dementia. They have no interest in it, but you're clearly describing Lewy bodies. If you'll go to nih.gov, there are publications on there for you that are free, and the one on Lewy bodies is about 40 pages long, and it is fabulous. You can also go to lbd.org, which is LewyBodyDementia.org. I believe it's still LBD, but LewyBodyDementia.org, and you'll be able to connect with information there. And then you would be amazed how many times the family member goes back to the doctor and says, no, it's this, this, and this. And it may be that you just need to find a better doctor. And it may be that your person actually has all three. Yeah, there's nothing on that medical license that says I barely passed. There's nothing on that medical license that says I was the last in the class. You know, so there's nothing, you know, some things on there we need a little more information than that. So, you know, your person may very well have 3 dementias. That would not be unusual either. So there's something the doctor's seeing there that's making them say vascular, something that's making them say Alzheimer's, and then somehow they're unaware of these hallucinations, that those are indicative of vascular dementia or Lewy bodies dementia. And remember, we treat the hallucination as real. So if there's a big box on her, we take that box off. If there are snakes on the floor, we kill the floor with the broom and then we sweep the snakes out. My first experience with Lewy bodies, the lady had all 4 hallucinations, and because we're in Texas, it was rattlesnakes on the floor, it was scorpions and black widow spiders crawling on her. Then her cousin Bubba showed up every day and beat the hell out of her. Then for him, we'd call the sheriff and tell her we'd had him arrested. And then she could see people having sex everywhere, and that was upsetting to her. And then she also saw children playing, so she saw all of them. And we kept a broom in her room to kill the spiders, bugs, rats, and snakes with. We kept a phone in her room connected to nothing so that we could call the sheriff and report Cousin Bubba had been here again. And they put out an APB for imaginary Cousin Bubba. And we made a place for the children to lay. We put a bassinet in her room so the children had a bed to go to. And we did everything we could to support her. And it was terribly stressful on her. It was stressful on the staff because we didn't know what else to do to help her. Now there is a medication called Nuplazid that's used to address those hallucinations in people with Lewy bodies.
Okay, if you are on Zoom, I posted earlier Tam's contact information. For those of you that dialed in on the phone, let me just do that real quick. Her phone number is area code 254-216-3668. And she really does want to hear from you. You may have to leave a message and she'll get back to you. She does travel the country doing presentations. You can email her, but that's not the easiest way to get hold of her. And then her website is www.tamcummings.com. And so you can also go there and look at some of the information that she has posted. There's information about her books, which are so helpful. So I think that you would be wise to go to that website for her, for sure. Of course, I'm one of her biggest fans. And like I said early on, I learn so much every time I'm on with her. I want to tell you a little bit what's coming up on the Caregiver Teleconnection on Monday, May the 9th at noon Central Time. There's going to be a presentation sponsored by the North Central Texas Caregiver Teleconnection Program. They're going to be talking about federal, state, and local services, and Donnie Green's going to be presented. So that's something about resources. Anybody that's caring for someone that has any type of dementia certainly needs to know about resources that may be available to help you. In the next few days, if you register for the session today, you're receiving a follow-up email. I would ask you kindly to take the time to answer the questions on there so that we can get feedback on these sessions. If you've heard someone speak that you would like to have us on the Caregiver Teleconnection, please let us know about that. Or even if there's a topic, we'll do the research and the legwork if you'll let us know if there's a topic that you would like to hear about. Check out the podcast on the Caregiver Teleconnection website. There's been years of them done, and so you can look up a topic or a speaker and find the information that will help you as a caregiver, whether you're a professional or a family caregiver. So Tam, final words today. We have gone over like we always do, nothing new there.
Well, I'm so alarmed about the tornado. I keep one eye on the outside, but everybody, you're doing the best you can. And in every single moment, every decision you've made, you did the best you can at the time with what you knew. So your homework assignment is to write a letter to yourself about what a good caregiver you have been to the person you love. And this will be both hard to do, but this will be something you will cherish greatly as time goes on. So have a good month, have a good week, have a good rest of the day. I realize I'm depressing as all get out, but hang in there. You're not alone, and you really can reach out anytime.
Information is power in my book. Come back. See us again next month when Tam comes back with us again. Thank you so much for joining us today, and I wish you so much wellness and happiness. Bye-bye.
Bye-bye.